The management of behavioral health care in Wake County and in North Carolina is in transition. The latest change will require counties to become Medicaid-managed care organizations and take over the responsibility of dispensing behavioral health care paid for by Medicaid dollars. This will occur in the form of a 1915 BC Medicaid waiver, part of the state's plan to make mental health, developmental disabilities, and substance abuse services more effective and efficient by offering counties the opportunity to have greater flexibility in how they spend federal and state funds for these services. Denise Foreman, the assistant to the county manager, is a project lead for the county's Medicaid waiver leadership team.
A 1915 BC Medicaid waiver will give counties the opportunity to manage Medicaid funds for mental health, substance abuse, and developmental disability clients in the Wake County areas or in the areas that are served by local management entities across the state of North Carolina.
Wake County has submitted an application to establish a standalone mental health authority to oversee care for Medicaid clients with developmental disabilities, mental illness, and substance abuse needs. Medicaid is the federal agency that pays for health care for low-income people.
The state's goals in working with local management entities to implement a managed care, or the Medicaid waiver, are to improve services to the consumers and to improve the cost management of those services.
Carlisle Johnson manages Wake County's local management entity.
So that we receive the funding up front for Medicaid, and then we'll have the responsibility of managing within those funds to make sure that people are served well and they receive the care they need. One of the biggest changes that we see locally is managing within a capitated system so that we're setting up a system of care that better meets people's needs.
People interested in the county's Medicaid waiver process and the management of behavioral health care in Wake County can get more information at wakegov.com/humanservices/waiver. For access to mental health, developmental disabilities, and substance abuse services in Wake County, including crisis services, visit wakegov.com/LME or call 919-250-3133.